A very good evening to all. Uh, for me, talking to you all is like uh, talking to our own family, basically. So we will not be lecturing, rather we will be discussing, sharing some of our experiences with you and all. As Dr. Sheetal has introduced, probably the thing that connect all of us is definitely Ayurveda, and the thing that connect all of us today is definitely uh, Krishna Kumarji too. And I believe, I don't think I believe, rather it's truth, that great masters never leave us basically. Now, when Krishna Kumar sir is not physically present with us today, I in no way tend to believe that he's not with us. Rather, he will be always with us, always with you, always with me. Before I begin to my topic, probably I would like to share with you because for me, it was for the first time that I had been to Tatwaprakashini as a faculty last time. Before that, I had been with Dr. Rahul to attend thing. When I was a teacher at Parshni Kadava and all in Department of Panchakarma, I had heard of Tatwaprakashini. I used to motivate my students to attend, but we could not do that because it was a long schedule and we used to have our OP, IP and all. Getting out from there was all technically difficult. But and whenever a few students come and attend and they come back and speak about it a lot, basically. So I always had this intention of getting an opportunity to be there. And my personal, always Krishna Kumar sir was a person whom you used to see on stage, right? As a student, of course, being a faculty, we had opportunity to interact better. But as a student, when I was doing my BMS and MD and all, he was a person always on stage, and we used to be in the audience and listen to his words, basically. And my personal link with Krishna Kumar sir was basically through Nadi Pariksha workshop and the Karma Prakashini series on Panchakarma that was organized at AVP, and I was there for 1 or 2 of the sessions over there. And it was there that I had started to have an interaction with Krishna Kumar sir, as you all during satsangs basically. But my experience with him is like I how a person can be, how a person can influence others within a short period. We could learn from him. I'll just share a simple example with you. I had been to a CME in Jamnagar last year, June, July. Okay, so I was going to Jamnagar. So somewhere with something, I had messaged sir, because there was some program that has to be confirmed with him or something. So I was just telling, I'm on my way to Jamnagar to attend the CME and all. So I thought, I just messaged, okay, I will be, I'm thinking of going to Dwaraka if it happens and all. So he just messaged me back that, would you like to have any help? I mean, anything? No, no, sir, it's okay. I mean, I don't know what is going to happen there. That's it. Okay. Anything needed, you just let us know. So I thought, okay, sir, but we know now he's a busy person and all. Why should we disturb him? And we have our own thing. And I reached Jamnagar. The next day, I had a call from Dwaraka. Okay, a person, okay, a senior person had called me and told ki, Dr. Ramya, you are in Jamnagar. When are you coming to Dwaraka? We are here to arrange everything. Dr. Krishna Kumar has called and told everything. So I was like, dumbstruck, because how come uh, when I was telling him I'm going to Dwaraka, I never thought it was a serious issue as far as he is concerned. Rather, who will, even if my student tells something to me and all, I used to find, okay, fine, that's it. Who is going to take pain to arrange something for the other person or something? Who is going to take all those things? And next day I had a call and he was literally, when are you coming? We will arrange, shall we arrange the vehicle? Do you know the way XYZ and all? He was asking. He was a very senior person talking in Hindi to me, and Krishna Kumar ji ने हमको बताया था, तो आप यहाँ पे हो, हम आपके लिए क्या कर सकते हैं? So the feeling that you have, the reverence that you have for a person, because such a person who's so busy with things, he could have time to make us think for this. And this, I had heard from so many people. not from 3 or 4 or 5, with so many people, that he was like doing these things. This was enough for me to have, I always used to, when when there was when we heard the news about his demise, he was in hospitalized and etc. But always I thought, or we were thinking, that he'll be back as usual. Hospitalization was a part of his games for last few years probably, so he'll be back. That was the thing. But just before he leaving, we at Ashtangam Ayurveda Vidya Peedam was having a Guru Mukham series with him, and he had actually he had inaugurated that series. He was of course not very well at that time, but he had talked about the difference between, what's the difference between guru and teacher to a great extent. And he was very seriously thinking of what you call it, as very seriously concerned about the qualities of teachers, because they are going to make students, and he was constantly, his restlessness was very, very evident actually. He was sharing his restlessness because how important it is for the teachers to get transformed, so that only the next generation, how responsible individuals have to be. So he was always taking opportunity to make these things happen. And I'll begin with sharing one more example. One of our students, okay, I'll not name her, okay, our first year student. So we at Ashtangam had arranged a few, he had actually come and inaugurated Ashtangam's first batch introduction. And we had arranged a interaction with students and faculty with Krishna Kumar sir during the 2016, 17, 18, that particular time. And something, there he told, I want to interact with students, I don't want faculty with me, so could you give me the freedom? So we were like, fine, what is there, sir? We are happy that you interact with our students, our first year students. And he interacted with our students for 1.5 hours, and then we had interacted. And things went on. I still, after during these last lockdown days, one of my students, or two of my students, actually showed me a shawl and a book that they got as gift from Krishna Kumar sir. Okay, so I was literally so. That student had told me that, madam, sir's health is not good. I heard, what is the reality? I would like to know. I am very much disturbed. The student had called me, and she was expressing her love towards him. He was like a grandpa to me. And then, so it's okay. I mean, I was telling everything will be. Then she showed me, this is the gift that he had sent me. He had given me a book so that I read and get inspired. And I was like literally dumbstruck again. A first year student was supported by him, and he was telling, I was, whenever I am mentally low, I used to send messages, he used to support and all. So how a person could get time to take care of even a 2016-17 BMS student, with such a gap. So that inclusivity was something that always made him a different person, a person who was with close to our prime minister, okay, a person who was as close to many other bureaucrats, politicians and all. And a person is equally close to a first year BMS student. And in Kerala, we had two articles. If I start talking about him, I don't think I can stop, but I need to tell you, I think. There was an article in here published in a newspaper wherein a person was expressing his experiences when he was traveling with his co-person guide, that he just suddenly stopped near a very small tea shop, okay, when he was traveling to Kerala. And he asked that person, we will have breakfast from that tea shop. Okay, so that tea shop was run by a very ordinary, I mean, a normal person. In Malayalam, in Kerala, we call it as chai kada. Okay, so this person who was with, I think, Gunashekhar, and I don't remember, he was asking him, why, sir, this small hotel? We have so many big hotels. We go and have breakfast from there. Then, sir, it seems told, no, we will have the same thing from here. They are not having business. If we go and eat something, that will be good for them. So we will go to that shop and only have our breakfast. So they went to the shop. It was a small tea shop, but of course clean. But they could see the things and all were there were very less. Okay, the stove, the vessels, everything was very little, and they were struggling to survive. Krishna Kumar sir, after having food, and they came to their native, I mean here near our place, which was his mother's house, he had actually made his person with him to bring a set of new vessels and all other things required for making a shop, I mean to run a shop, what is, and he had gifted him that person. And that tea shop person was awesome and dumbstruck with the help that he had. And he never claimed it since. He just asked the driver, you just go and get these things and give them so that they can survive. Who will do this? And when I read this one, it was like, how come somebody can, I mean, it was so what you call it as uh, it is inclusivity basically, nobody else can think. So that he had never spoken Ayurveda to us alive. He had never spoken about Vada Pitta Kapha. I've never heard him speaking about. He had spoken for Ayurveda. He had spoken for Ayurveda, for what all the methodologies could be followed, how you can be spiritual, inclusive, XYZ. So, the personality of Sir that he was representing was multifaceted, multifactorial, beyond understanding. And, it was like too much, I mean, beyond things. So I feel the greatest tribute as physicians or people for Ayurveda that we could give for him is to keep his values going on, probably, to learn and understand. I mean, try to getting up early in the morning. You remember, I was a part of the satsang that he was conducting early in the morning, and I still say, I'm not getting up now at 5 o'clock because Krishna Kumar says satsang has got. For me, during lockdown, that was an important alarm. Okay, I'll just attend him. So, but the thing as Ayurveda people, the greatest thing that we could do for him is nothing but to inculcate the values that he has stood in our own life and try to practice it. And I think that is, if I speak about Krishna Kumar sir for hours, or write about him, read about him, all those things are very little when compared to the practices that we are supposed to be make as our own self or our own part. So I wholeheartedly wish, I wholeheartedly pray that including me and each one of you, that we are able to keep on the values. Great souls always come and inspire. And it is for the people who are on the other side to take it and move on, basically. So probably with Krishna Kumar sir, even though I couldn't imagine that he'll not be there last time in Tatwaprakashini, we were all dreaming next to Tatwaprakashini. So, I tell you, I had promised to sir that Ashtangam 60 batch, all students will be there in this year's Tatwaprakashini, sir. And I had asked my principal also, sir, we'll send all our full batch student to Tatwaprakashini for 15 days. We have to arrange, and we'll tell them, we'll give them attendance and everything. I had arranged actually. Okay. Because I could know what transformation could happen there. But of course, things don't happen as we expect, but what all things we can do, we will do it. Okay. So with remembering that great individual, with all love, respects, I know I have taken 10 or 15 minutes more, but it's okay for me. I'll go to the presentation. Now, see, as I told you, I don't want to go for a big thing. I'll be just NIRUHA, a journey from principles to practice. Now, you might have, all of us know Vasti is Artha Chikitsa. Now, I would like to just share with you a few clinical experiences, clinical things, like what is told in the text and how are we going to do it in our practice or clinics. Ultimately, I'm not going to speak too much of Panchakarma. I'm just going to speak up, how as a physician, we have to be keen in understanding and knowing things and practicing things, so that our ultimate target is what? To do the best for our students alike. So that is our target, that will be moving. So let me invite you to a very clinical setup. I mean, see, that's an IP. The practitioners will be knowing it. Students, if in the audience, they will be becoming someone. So an IP setup. So let us imagine a patient has been admitted with, for example, severe neck pain, knee joint pain, the commonest situation that comes to an Ayurveda hospital, probably. Okay. So we will think Vasti has to be decided. Okay. Should Vasti be done? If Vasti has to be done, which Vasti should I go for it? Should I go for a, yeah, there is some issue with Apana Vayu. There is some issues, Lakshanas of Pakvashaya Gatavada. So definitely Vasti is a choice, I think. Okay. Now, should Vasti be done first? I think, okay, fine. I'll go for a Vasti because of these reasons. Which Vasti should I go? Should I go for a Vaitarna Vasti or an Ardhamatrika Vasti? Should I go for a Madhutailika Vasti? And if at all I decide a Vaitarna Vasti, at what time should I do the Vasti to the patient? Is it at 8 o'clock? Is it at 9 o'clock? Is it at 10 o'clock? If that was raining day, when should I do? And even if I do it, how much should I do? Is this normal rule of 480 ml of kashayam, 240 taila, 240 madhu, 30 shatapushpa, and 10 grams of saindhava lavana, the common protocol decided thing under practice for a madhu tailika vasti, the standard one? Or should I select, I'll go for 180 ml of madhu because kabha is more, and 80 ml of taila because kabha is more in the initial stage, and I'll reduce a little bit of saindhava lavana because probably the bala of the patient is not that much, so that evacuation is not that. This understanding, will it happen within us? So how much should I do? And even if I do, how am I going to assess it practically? Because if you go for a vasti and we go to the, as for rounds we go, and we ask after Vasti, okay, how many times did you pass motion? 2 to 3 times. Okay. Now, are you feeling any lightness? No general weakness. Okay, fine. So is that the way that Acharya has told us to assess? How should I exactly assess what was the outcome of Vasti, and how can we move on? How with this outcome, if today the patient has got 8 or 9 Vegas in Vasti, should that be something that I have to think for deciding next day's Vasti? Or else is it all panchakarmas like decided one? Yoga Vasti likho to tumko pata hai kya karna hai, and you do it, that's it. That's, I mean, the medical officer does it, the practitioners writes it. Is that the thing? So let us see how, Charaka very, what do you call it, as at the outset in Basti Sutriyam, he says so beautifully, see, it is not only ikshya, samyak ikshya of what all things? Dosha, Aushada, Desha, Kala, Satmya, Agni, Sattvadhi, Vayo, Balani. Vasti hi prayukto niyatam gunaya syat sarvakarmani cha siddhimanti. Niyatam gunaya syat sarvakarmani cha siddhimanti. Okay, Vasti prayukto sarvakarmani cha siddhimanti. Not only Vasti, all karmani siddhimanti. Siddhimanti is become successful. Only, what all things you have to decide? Dosha, Aushada, Desha, Kala, Satmya, Agni, Sattvadi, Vayo, Balani. Now, when I say this, the questions that I have asked you earlier, should I go for Vaitarnavasti, Madhutailika or Ardhamatrika depends upon the dosha. Should I go for Vaitarnavasti with Gomutram, or should I go for Vaitarnavasti with Kulatha Kashayam or Dashamula Kashayam, the Aushada nature? Of course, is important. Should I go for a Vaitarnavasti with the Gomutram for a patient who is come from Spain, from a very cold country? I had a complication doing Vasti to that patient. That's my practical experience. And a person from Pattambi in Kerala, should both of them be gone for a same Vaitarnavasti with Gomutram? There was an issue when I did a Vasti for a patient from Spain, okay, who was exposed to very cold thing and all, and he was Bala was okay, but the same thing. So Desham was relevant. Should I, during this Sharat Kalam, after Varsha, the Amla Vipaka, and this Sharat, when happens, there are experiences wherein very young patients after Vasti, they fall down after going to toilet. I had seen that because lot of fluid loss is happening, and if that is not nourished probably, that has happened. And this happens, we have assessed in Ashtangam where complications are more, if at all it happens, it is especially after Varsha Ritu, and I had observed during Sharat Ritu. I'll be sharing with you some of our experiences. So the Kala is relevant. Satmya, I still remember a patient who had undergone Vaitarnavasti. On the first day she was okay. On the second day, that was when I was doing my MD in Government College. On the second day, whole body rashes came up immediately after Vaitarnavasti. So we thought, what's wrong? We were analyzing and all. So usually Gomutra for Vaitarnavasti, the patient has to bring. So thereby they have to bring and do it. It's not arranged by the hospital. So what happened? First Vaitarnavasti, they had collected some more Gomutra, and the rest of the gomutra they had kept in the fridge actually, which we never knew, and directly from the fridge they bought the Vaitarnavasti for the second Vaitra, the same gomutra, and they were telling the same gomutra we had used doctor the same day, same thing. But you know, this had brought some transformation in gomutra. So the body's satmita, or the body's response to any material, it's really experienced or expressed at that particular point. Agni is very important because I have always seen after Vasti, the patient's Agni improves if they have enough Bala, or if there is low Bala people or Alpa Sattva people, Agni will come down, which has to be taken care. And while deciding the dosage, Sattvadi Vayog, Sattvadi, he says. Sattva is very important because patients who are very stressed, they tend to have more complications or possibility of complications if they are not counseled properly, the Vaya and Bala. So see how many, what you call it as, how many variables Acharya has given us to analyze or to decide upon a Vasti. It is not standard protocol for everyone. Okay, so you know, when a patient comes to you, when a patient comes to us, it is very important that we assess all these things and come down for a Bhakti Yogam exclusively to that particular patient, experiencing or understanding what is that in all these aspects. So that we always have to keep in mind. It is not ki the physician says Vaitarnavasti, so there is a common protocol for Vaitarnavasti. You go for the same yoga to all. No, if that was required, why did he give all these things? Because if we understand this level and try to analyze things, you know, the efficacy, the output, the response of the patient by changing things according to this is entirely different, which is my experience, I will be telling you. So going for each point, which Vasti should I decide? So definitely, which Vasti should I go? Definitely for Vasti, Vata, Pakwa, Ashaya has to be the center. So let us have in that way. Okay, so we have decided for a Vasti, but which one should I go? Hetu, Adhisthana, Dosham, Dushyam, as I told you. So if it is Kabhatmaka, we have to think of a Ruksha Tikshnavasti like Vaitarnavasti. When we are moving on, if it is more of Ama, Churnavasti is told by just Chakrapani in Siddhisthana, Amritotram Kashayam and Vaishwanara Churnam only is given per rectum as Vasti, something called as Churnavasti or Rukshavasti. Then we are moving on to Yapanavasti kind of things, Madhu Tailikavasti, wherein Madhu Taila Same Karshaha, Saindavadvipi Churnisihi, Erenda Mulak So Tailaha Madhu Tailik, Vastihi Madhu Tailikaha. When you know, almost most of the practices in Kerala, especially, I mean, everywhere, it's like the common Madhu Tailika Vasti, wherein Madhu and Taila are Sama, and any Kashaya is added, mostly Erendamula Kashaya is added, which is actually a kind of Yapana Vasti. And Madhu Tailika Vasti, Delhana says it is neither Snigdha or Ruksha, it is kind of Rasayana. So we always are on the safer side. When Acharya Charaka explains more than 500 yogas of Vasti in Siddhisthana alone, in Ashtanga Hridaya Kalpa, when there are 300 to 400 Vastis alone, you know how many of are we, and we speak about Vasti as Artha Chikitsa, how many of us have been really, what you call it, as tapping by selecting the different kind according to the need of the patient? We need to think. Okay, so that possibility we need to think. Now, you know, how are we going to perform? Let us see the background. The clinical scenario, Vasti, if we have done in the ward, what we do is the common practices, number of Vegas we assess, retention time we assess. So is that enough key? How long did it retain? 1 minute, 2 minutes, or somebody says I have to retain for 3 minutes or I'll have to 10 minutes. Did you pass? How many times did you go to toilet? Or they'll be telling 5 Vegas, 6 Vegas. Is that the thing that we just have to note, or should we assess Vasti in a different level that we need to think? See, time of administration in clinical practice, there are two common things, especially in Kerala, traditional hospitals like Ashtavaidya group and all, they, you know, they do it at 8 o'clock in the morning without food. Okay. But in the academies, especially in the teaching hospitals and all, we keep up a range by 9 o'clock to 11:30 a.m. with prior little food. Madhyane kinchit avrite na ati bubukshitam. Why? Because during when we move on to the Shastra, when to do the Vasti, Madhyane kinchit avrite na ati bubukshitam Ashtanga Hridaya says. Madhyana has to just start and the patient should not be feeling too much of hungry. Ashtanga Sangraha also says kinchit avrate madhyane na ati bubhukshitam. Now see Charaka na ati bubhukshita. He doesn't speak of madhyana na ati bubhukshita. Susruta abhukte he says. So Acharya themselves have given options. Abhukte without having food. Okay. Susruta he says abhukte. Charaka says not ana ati bubhukshita, should not have too much of hunger, but he has to have something. So why does this range been given? And what is the possibility and how should we understand? So madhyane kinchit avrate, when moving from Charaka Susruta to Vagbhata, he new introduction of madhyane, the kala has come up. So basically why madhyane kinchakam kabha to pitta, because when we are doing any karma on the body, it is ultimately the body's response to that procedure that is actually bringing up the result. It is not that we do something like that. So the body's response depends upon the sharira of the patient at that particular time. So na ati bubukshitaya, for giving virechana, shleshma kale gade jnatva tu virechanam. Shleshma kala has to get finished. Shleshma kala of what? Patient and the temperature. So the shleshma kala, the appetite, the body's response to all these things have to be considered. So before giving vasti, we must have an understanding when I'm going for vasti, how the body is to respond and what my intention is to get it back. And hence, this particular time has been specified, wherein from the body moves from Kabha Kala to Pitta Kala. The maximum response when we do a Vasti through Pakvashya happens, so that evacuations happens in a much better way, because the Srodhas is not with Unmukhatvam. Now the second issue that we practice over, so time of administration as of thing is madhyane kinchit avrite na ati bubukshite. So this madhyana varies. If it is winter, the madhyana can be between 10 or 10:30. When it is summer, the madhyana has to be like kinchit avrite, it has to be 9 or 9:30. So according to Ritu, we have to understand that. Now the second issue of the sag of retention time, many places in Kerala, there is a practice wherein patients are made to hold the medicine. Okay, even though they feel like going to the toilet, the patients are made to hold. Kitel, you hold for 5 or 10 minutes, okay, and so that the medicine act. Is that correct? Did Acharya intent of anything, that such thing? And the indications of Samyak Niruha Lakshanas. How are we going to assess Samyak Niruha Lakshana? Because the indication, Samyak Niruha Lakshana, are the indications for the physician to understand that the procedure has acted the best in the body. So we have to assess Samyak Niruha Lakshana. Maximum what we do is, how many times did you go to toilet feeling light? No, that's enough. So is that the correct way to assess Samyak Lakshana? And it is very important that we understand Acharya has not mentioned a disease-wise Samyak Lakshana. Rather, he has given us a general thing of all panchakarmas, of all Samyak Lakshana in a different context. And then he is explaining about the chikitsa. In each chikitsa sthana, he says you go for Vamana in Shwasa with Pipali. You go for Utklishta Avastha Jwara, Tatra Utklishte Samutklishthe Kapha Praya Chale Male. In Jwara, you can go for Vamana, with which they give us an option of many other things. Okay, so drug wise individual Samyak Lakshanas they have, disease wise Samyak Lakshana has not been given. Why? Because every disease will have a different kind of dosha samurchna which will be presenting in a different way, but body's response to that kriya krama can generally be taken by the Lakshanas told as Samyak, which is the guide for the physician to understand. So with all these things, do you think in many places the paricharaka does the vasti? Okay, it is the many times therapist is doing the vasti. Therapist does it and they just go, okay, go to the toilet, take bath and go. That's it. I had seen in many places. With all these intricacies, when you say Arthamatrika as chikitsa, can vasti, niruha vasti, be what we call it as, be a physician out of the situation when we are speaking about niruha vasti. So let us come to the Samyak Niruha Lakshana. Prasrishta Vinmutra Samiranatvam, Ruchi Agniviruddhi Ashay Laghavani, Rogopashanti Prakritistadatcha Balamchasya Suniruda Lingam. So wherein he says Prasrishta Vitta Mutra Samiranatvam. Vitta Mutra Samiranatvam has to be Prasrishta. Ruchi Agniviruddhi Ashay Laghavani. So Ruchi Agniviruddhi Ashela, Rogopashanti and Prakritistadatcha. Along with that, Ashtanga Sangraha says, Like Virechana only Samyak Niruha Lakshana happen. And for Virechana, what is that? Kaphantam is for Virechana. So in Samyak Niruha Lakshana also, Prasrishta Vinmutra Samiranatvam at that particular point, after which you have to analyze whether Agni Vriddhi has happened. So after we do Vasti in the evening, you have to go and ask the patient whether there was improvement in Ruchi and Agni Vriddhi. If there is not that, you have to think of whether should we go for the same Vasti on the next day or not. It is very important to understand because these are the guidelines. If a patient says, "Ki doctor, after Vasti, I feel so weak, I don't feel like having food, I'm very tired, XYZ," then you have to understand ki the Vasti that I had given has not moved or responded the way I intend. So I have to think of some other thing. This understanding we need to have. Yoga Lakshana, see, if the patient presents Shiroruk, Hridgudavasti, Linga Shopa, Pratishyaya, Vikartikecha, this I have experienced, when we go for Vastis with less of Saindhava, imagining some kind of complication, and patient says only the medicine has gone out. By the evening, they will be having some kind of nasal congestion or something. Hrillasika matramu, Hrillasika Maritamutra Sangha Shvasona Samyaksha Niruhati. So some kind of kapha dominance in the body happens if there is no lakshana, if no proper evacuation or samyak activity of Niruha does not happen. So when we assess, even immediately after the Vasti, we have to assess the patient. On the evening, you have to assess the patient. Next day, you have to assess the patient, how things have happened before we decide for the next Vasti or next course of treatment. So in the evening, he says, I feel some difficulty or some kind of heaviness of the head or some kind of nasal congestion or some kind of abdominal distension or anything. Then we have to recheck what has happened with the Vasti. Ati Yogam, he says it is definitely like Ati Virechana. And for Anuvasana Vasti, probably all might have are experienced by doing Matra Vasti. And what happens usually is Matra Vasti is given, and Matra Vasti is given, and the patient is asked, "You go to toilet?" Okay, whenever you go to feel like you're having toilet, that's enough. Very specifically, even Matra Vasti or in Anuvasana, Pratyetya Saktam Sa Shakrischa Tailam. Tailam has to be evacuated Sa Shakrita with the feces only. And if only Tailam is gone, it has been told in text that immediately you have to go for the action has not happened. So immediately you have to go for another Snehavasti or Anuvasnavasti or Matravasti. Otherwise, the intended action is not happening. So we tend to overlook this particular thing because we never understand or analyze how this Vasti is acting on the body. Because whenever, if we go to, once we go for a Matra Vasti or Anuvasana Vasti, we have to again go to the patient to ask how much you retain and what did you pass. If the patient says, "Doctor, I passed Thailand with motion," very good. Feces was there for Matra Vasti too. If the patient says, "No, doctor, after 1.5 to 2 hours, I just went to the toilet and was just oil went off, nothing else," then we have to assess this is either our dose has not been correct or the avastha that we have given a Vasti or nas done. So immediately the next Vasti has to be given. So this only when we do and analyze things in this way, we'll be able to practice science in the best way so that we could get the results in the best way. Okay. So what I have done is I have tried to look upon or during a particular period that when we were discussing these things, I just observed different, nearly 75 Vasti that had happened in our Vasti, irrespective of cases, to analyze what was to collect some data. And this data we will discuss in the end. Okay. So the variables considered in the data was the prakriti of the patient, koshtam, because was the nature of koshta and the samyak lakshanas related, the retention time, blood pressure before and after Vasti, the number of Vegas, and the Samyak Niruha Lakshanas that were happening. So I'll just share with you the observations in that after I had observed. Okay. Average retention time. So nearly 75 Vastis were taken. 60 plus were included and some were excluded because of the criteria, not getting into criteria. So average retention time and number of patients, 60 among the 60 patients, 44 patients, retention time was nearly up to 5 minutes. 6 to 10 patients, 13 were there. 6 to 10 minutes retention was for 13 patients, and only one out of the 60 patient had a retention time above 20 minutes. Okay. Now retention time and its relation with number of Vegas. The first category, if I just, it was average, okay? So retention time and number of Vegas, the patient with more retention time had 3 Vegas, and patient with a retention time up to 5 minutes and all had an average 3 or 3.5 Vegas. It's again average. And retention time and Kabhandam, which actually indicates the Samyak Niruha Lakshana. So was it related with a retention time? Like people who retained for a longer time, did they get Kabhandam in a better way, or was it not related? So people who are out of 44 patients who had retained up to 5 minutes, 32 had Kabhandam in the first itself, and among the others, nearly 18, and all of them above 20, both of them got Kabhandam. Now, you know how will be assessing Kabhandam? Delhana in Susruta commentary says Spatikabham Kabam. That means Spatika means it's like a white content, okay, white frothy liquor things. So patients, when we assess, we ask them, or we give a counseling before Vasti, and we ask them to see what you are passing. So if it is just initially, they'll be passing yellow fluid or motion, which is very loose, and after that they'll be having some kind of pieces, and towards the end, if they pass out frothy thing, which are very sticky, they'll be experiencing it in the closet itself. That is actually Kaphantam. So there was when some senior Vaidyas who were assessing ki Kabhandam can be got not only during that immediately after Vasti, that can happen even in the evening or next day when the body responds. After such a discussion, I had observed patients about during the evenings after Vasti, and there were many patients who, even though we did not get Kabhandam immediately after Vasti when they passed 3 or 4 motions, but in the night or evening when they passed motion, they told I had some kind of mucus thing coming out, which is very frothy and mucus in the material. So that also we have to analyze to understand how our, because unless and until my only thing is to put emphasize is how the body is responding to the procedure, we have to very closely observe. So if we take how individual kind of Vastis had responded, like for Kshira Vasti, the average retention time was 6 minutes and average number of Vegas for 2.67. Number of Kshira Vastis in that group of 60 was 6. Rajyapana Vasti, 4 Vastis were there in that group. Average retention time was almost 11 for Yapana Vasti and Rajyapana Vasti, Mustadi Rajyapana Vasti. Number of Vegas was nearly 2. Number of Vastis, Ardhamatrika Vasti, the Dashamuli Kashayana Ardhamatrika Vasti, retention time was again 2 minutes, average number of Vegas were again 3 plus. And Lekhana Vasti, which is the Lekhana Vasti with Trifalakphata Gomutra Yoga, number of Vastis were 6, the average retention time was 3, and average number of Vegas was 3 plus. Retention time and Prakriti, it was not considered because Prakriti had lot of discussions and discrepancies. Now see, retention time and Koshta, was it any relation between that? So in Krura Koshta, the retention was 9.7 minutes. In Madhyama Koshta, it was 4.3 minutes. And Murdu Koshta, 3 minutes. So you could see there is some relation between retention time and the nature of Koshta too. This gives an indication for us. Retention time is definitely related by the nature of Koshta too. Koshtam and Kabhandam. What the nature of Koshta and Kabhandam related? That means Samyak Lakshana related. 12 Koshta, Krura Koshta people, 5 had Samyak Lakshana. 44 Madhyama Koshta had 26 Samyak Lakshana. 4 Mrudu Koshta had 1 Samyak Lakshana. This was observation. Okay. And retention time and status of food intake. There were actually 2 physicians of our hospital used to do Vasti early in the morning. And most of the other physicians would definitely recommend Nati Bubukshite Madhyane Kinchitavrite. So among these 60 Vastis, 53 was done at Nati Bubukshite and 7 Abhukte it was done. So retention time for them was actually no specific difference was seen. But on the same day, Samyak Lakshana, soon after the Vasti, we could see in 35 patients, and Samyak Lakshana or Kabhandam in the evening, 7 patients presented Samyak Lakshana in the evening. Okay. Now, Samyak Lakshana on the same day, like of Laghutvam, Srodoshuddhi, nearly 42 patients felt on the same day. But on the same day, only 14 patients spoke about Agni Vriddhi. But Agni Vriddhi was evident during the next day of doing it. Okay. So Agni Vriddhi, Samyak Lakshana on the second day, Laghutvam 42 patients, Srodoshuddhi 42 patients. Agni Vriddhi was again on the second day, nearly 40 patients. So we have to understand from this data ki immediately after the Vasti, the thing that I can assess was Laghutvam. If the patient is feeling Laghutvam, even though Agni Vriddhi in the evening, the patient doesn't say, let us wait and see on the next day. I mean, he says, I feel lot of appetite on the second day. Okay. So see, retention time with these understanding, I mean, with these observations, retention time is directly related with nature of Koshta. Also the addition of Lavana, because if you add a little more of Lavana, lot of this Lavana actually acts with a hyper concentration of sodium which supports the osmotic activity and removes things from the body. So we had two or three too much of evacuation and some kind of dehydration happened in a group of during a period 3 incidents happened. So we maintain a Vyapat register. Okay, so if at all there is anything, we write in the Vyapat and try to analyze why this happened. So once during the month end, we do that in the department. So when we do that, so this happened during a particular time. Of course, we had managed, so we had to understand why. So that time we could understand ki it was actually the Vasti was mixed by the same therapist, and he had actually used this was my initial time period in Ashtangam. So he had used 15 grams of Saindava instead of 10 grams, which we usually practice. Okay. So, and he used to mix like that. Okay. But this packet was of 15 gram he used to. And from that particular point, I had made it mandatory that the physician, the medical officer has to be there whenever the Vasti is being made. It is medical officer who has to give the medicine for the therapist. They have to take care of it. And after that, we have a exclusive Panjarma medical officer who monitors if we are not there. I mean, the department faculty will be there other than to monitor and assess and think of each procedure. We had taken it as a responsibility of the physician, which we are supposed to do. So if this is not done, so the amount of Lavana actually indicates the evacuation, excessive evacuation. The nature of Koshta is also important. So before Vasti, if I think the nature of Koshta, is there something, I have to think, should I change some yogam or should I change some in the medicine or something, that I have to analyze. Okay. Now I'll just a few complications that we had faced during the Vasti because of the issues that we have recognized later. She was a lady, name changed Mrs. Malini. It was the case, I'll explain you. It was a chronic Vataraktam. She with all crippling, like all joint, deformed joint. She had these issues for more than 10 years. And she was under our treatment for last 2 years probably. He had come and initially only Ruksha with Dhanyamladhara and all. And for the second term, we had made her undergo Ardhamatrika Vasti. She was fine with it. And on the third admission, she was made to undergo a little bit of Brahmana in the initial, like it was like a gap of 4 or 6 months was kept with internal Pachana and over period, and its stage-wise treatment was going on. So on the third time when she came, initially some kind of Svedana was done. She was better. And immediately we had planned for Ardhamatrika Vasti after a week or 10 days. And immediately after Ardhamatrika Vasti, she was comfortable with Ardhamatrika Vasti in the previous time. But after that, she passed motion, she was okay. She was trying to have food and immediately she lost her consciousness. I mean, and she was like, I was called immediately. I rushed up, I did CPR, and then we revived with Siddhamakarαδvajam, etc. But then I observed what was the reason for that to happen. So on inquiry, we told why did this happen this time? So she never liked kanji, which we usually give in the morning. So she had kanji only very little. Okay, she had kanji only very little. She did not have water much. And on the previous 5 days, we had made her undergo Patra Potla Sveda, which was actually a Sveda Kriya. So a person which is actually contraindicated for Vata Rakta, but being it is like Vata plus at that particular time, we thought it would be considering even though Samtapti was Vatarakta. So I thought Allah, we could analyze ki Vatarakta, which is basically contraindicated for a Sveda. We had made her Sveda, body Sveda, made her undergo Sveda. If Vatarakta is in the Samprapti, if we are making it undergo Sveda, the Rakta, there will be some kind of Rakta Dushti or Pitta Dushti and Vilayana might be happening. And immediately if we make her undergo Ardhamatrika Vasti, the Kleda Harakam from the body is much higher and the body is unable to withstand it, especially when she was not supported with enough Ojasya kind of food that she's supposed to have on the morning. Last time she had been undergoing some kind of small Dhanyamala Dhara for a little minute, and then we had made her undergo Ardhamatrika Vasti. She was fine with it. But when we did it this time, this was not. So the body had responded in a different way because the Kriyakrama selected for her was not the exact thing. Okay. And this one more case was Sharat. Okay. What happened to Sharat was he was a case of multiple sclerosis, and a senior physician will discuss it, and we will go for a Vasti, and he was unable to work with all the crippling things. He had this issue for almost 3 to 4 days. So he had actually selected, sir has actually said Kalyanaka Kashayam and Shardharna Churnam as Amahara in Apakwa Asya. We will correct that one. So Shardharna Churnam Kalyanakam Kashayam was given almost by 10:30 or something, 400 ml Kalyanakam Kashayam to 15 grams of Shardharnam Churnam. So that was a senior sir, and I was having I was called that after 1 or 2 hours also the patient is not evacuating the thing. Paksha patient is very fine. So what we did at that time, but for 2 hours happened, we'll just wait, let us see. 3 hours, the patient was not evacuating, the therapists were waiting, they were having other work and all, but it was not any difficulty, no. Then you know what we tried to evacuate it with Gandharvastali Kashayam. Did not happen. Gandharvastali Kashayam did not happen. Again, I gave only 100 or 150 ml Gandharvastali Kashayam with a little bit of Saindhava. It also went up, it did not come out. And then I tried Nirgundi Erandatailam, 75 ml. Okay, so actually the Shastra says to give Phalavarti. Patient is of course having no other Tikshnavasti and Phalavarti, but since he was actually crippled, we tried only this kind of Nirgundi Erandatailam for almost 75 ml. No response. Okay, so the body was having the Kalyana Kashayam, Gandharvastali Vasti, Nirgundi Erandatailam, but patient was not having Vasti. So I kept him under observation. I said to medic, let's see how the body is responding to it. The patient was happy. Patient was. So finally, I had sent him to the room because we were stressed, but patient was having none. And I had made and in the morning, you know what happened? In the morning, he just passed all these things together with no other issues. So I analyzed these things. Basically, you know, any Vasti without a Saindava, especially that will not be helping in evacuation. The first Vasti was done by Kalyanakam Kashayam and Shardharanam. That selection was not good because we had experiences for Ruksha Vasti wherein Amritotram Kashayam and Shardharanam was given, no evacuation happens because there is no Saindava. But Amritotram Kashayam and Vaishwanra Churna is mixed and given, evacuation happens because Vaishwanram itself has got Saindava in it. So Saindava is always an ingredient for Vasti. And you know, so Gandharva Hastadi was given as a Tikshna, the Gandharva Hastadi with little Saindava only I added because I was apprehensive because if too much of evacuation happens, since this patient was a crippled patient, he may feel weak or something. And then I went for an erranda, even that did not came. So the cost of the patient was so krura, which I analyzed later and I consulted. We said our observation that it is better we go for with the Saindava after 2 or 3 of Snigdha Vastis, and that was done, and that was the patient had responded. One more case was again, she was Rachel. She was a nursing student, and you know, her issue was severe constipation. The physician had admitted, and directly on the first day itself, he advised Vaitarnavasti. So in our hospital, we made it a point after all these experiences. Okay, what happened was Vaitarnavasti was given after 1 hour. The patient had not evacuated. So I went and I saw. Then I could understand that her Koshta was so krura that she has not passed motion. She usually passes motion only once in 3 or 4 days. And you have given Vaitarnavasti, which is again Ruksha in that context, and the body is not responding because already Pakvashaya, the Vatasthana, which is Ruksha with Katu, Paka of all kind of Ahara, You're again without going for any snigdha. And then I gave kind of Ushnodaka with a little Saindhava, because we have to evacuate it. That is very important. So like Tishnavasti, still she did not evacuate. I waited for her. Then I made her to sit in Utkutasana. Because I made her to sit in Utkutasana. Basically, we have always European closet in our hospitals, right? But Acharya says to sit in Utkutasana after Vaitranavasti, I mean after Vasti, because that position also important. So I asked her to sit in Utkutasana for almost 5 minutes. After that, she felt the urge and she went to the toilet. So all these things supports the action of Vasti. So these are the n number of things that we need to understand or analyze. Okay. So the data that I had given you or presented with you, I would say ki, towards the end, there is no obvious conclusion from our data. Okay. Because I was telling there was average retention time or average thing, etc. Because average in functional biology is actually an absurdity. If I say I analyze 10 Shiravasti and say the average retention time of Shiravasti is 5 minutes and Vaitarnavasti is 10 minutes and Yabhanavasti is 11 minutes, that's absurdity. Because functional biology is something that how the biome is responding to something, the stress or the challenge that's happening from outside. And our Ayurveda deals with functional biology. We are actually giving a stress to the body to respond. We are actually challenging the body in a controlled fashion that the body respond to it. So when that challenge or the this thing stimulation is given, it responds according to the medicine or the thing stimulation that we are giving and the nature of the response. So we cannot have averages. So our, what you call it as, when we are working upon the vastis, or when we are work and as assessment of vastis, more importance should not be given in these kind of average calculations using mathematical or statistical calculations, which may not help us to a great extent. Rather, I feel the objective and subjective outcomes, the way I analyzed, contributes nothing to the Shastra and its practice, basically, if we analyze it in that way. Average, average, average. Rather, every Vasti has to be analyzed in relation with the Rogi, his Samprapti, and the Pranidhana Vishesha. Pranidhana Vishesha, as I told you, what is given, when is given, how much is given, at what time is given. These are many other factors that the body, I mean, we have to consider at that particular point. So the range of possibility of Shastra has in itself standard operating procedure. See, Shastra has given us as an SOP, what? Samiksha, Dosha, Aushada, Desha, Kala, Satmya, Vayo, Bala, Avastantarani and all. He has given us a standing operating. But intelligently weaved outcome has to be assessed by using Samyak Lakshana. So if Samyak Lakshana, if you are not getting, okay, so you assess Samyak Lakshana in the patient. You assess how the body is responding rather than thinking of the retention time of number of Vegas. Rather, you are supposed to assess these things. So these how we are the standard operating procedure with respect to the body's response. Madhyane kinchit avrite nati bubukshitaya. He gives us the procedure. He gives us the way to analyze. So all these things are more important only when we understand these intricacies that is intended when we are doing a Kriya Krama to the body, we will be able to execute it in the most precise way. So our responsibility towards the end is to understand Shastrarthas, practice accordingly, and evaluate holistically. So when we do, many a times I say, our whole IP is based upon the quality of Panchakarma that we give. We discuss a lot about yogas. We discuss a lot about whether should we go for Rasna Saptakam, Rasna Panchakam, Rasna Rendali, etc. But what is happening in the body of the patient in an IP is through the Kriya Krama, and it is such intricacy, specificity is very much also required when we are doing or assessing any Kriya Krama. It's not just doing something and let anything happen and we just go and have you're okay. Like, no, these kind of intricate understanding we need to work upon. So the Ardha Chikitsa, to evaluate Vasti, we need to have an holistic understanding of the Rogi, her basic or his basic pathology, the Samprapti, the administration of the procedure. So understanding the Samprapti of the Rogi and the correct way of administrating, considering all these things. the physiology of the patient, the prakriti, the koshta, the vaya, the sattva of the patient, and the best suitable vasti for the samprapti of the patient. Even if you select the best procedure and understand the samprapti, how we are giving, when we are giving, at what time we are giving, are we adding the required amount of saindava, are we mixing it in a proper way, is the patient properly hydrated, the patient, is she feeling hungry or not? So these all aspects becomes the agni pariksha for the physician, for the bhishak to understand. Unless and until this is done, we'll not be able to do the things in a proper way. So follow, we have to, as physicians, rather at this point of time, with a little experience in doing things and the IP level and all, follow each cases totally. My ultimate, advice or the conclusion would be, the follow each cases totally with subjective and objective functional analysis after thorough and understanding of the underlying samprapti, which is very important. Because totally, how the subjective outcome is happening, how the objective outcome is happening, both the things are relevant, but subjectivity has to be given importance in the background of objectivity too. So Vasti Karma assist individually, forgetting the Samprapti has got very little useful. So this does not pertain only to Vasti Karma, any Kriya Kramam. So whenever what happens is, what my intention is telling is, when we assess a Vasti, you just go and ask how many times did you pass motion, 3 or 4 times. Okay, that is not the only thing that you are supposed to understand or we are supposed to do. Rather, you have to analyze all these things in the background of the mana. So the utility, the understandability, the holism behind the practice of Vasti through our rational practice and deep analysis has to be done. It is not like you go for same Vasti for all and do anything that you want. All these things are very specifically intended in our Shastra. So if we bring about these kind of changes, when I think of Yoga Vasti, I start with a greater amount of Madhu, little of Thaila in the first, and then I go for a Sama, and towards the end I increase Thaila and little Madhu. Because that Kapha and then considering Vada in the end. I start with, if it is Vatarakta, I may start with the Rukshavasti initially, then I go for a Vaitaranavasti if needed, Allengil Ardhamatrikavasti, and only at the end I may think of Madhutailik or Shiravasti if the Agni is proper. So how should I move? How should I make this train important? Understanding the background of the patient. So Bela Samhita says, Jnanavamsha mitaharo vaidya sushrurevacha yascha vasti mupashita sa jive sharadashatam. Who understands the mitahara, who is knowledgeable about mitahara and who knows how to maintain health and who practices vasti on himself. Okay, he lives for Sharada Shatam. He lives for 100 years, he says. Okay, so how many of we are practicing Vasti on our body? And I very much practically feel, it's my, Udavartam turns to, it's my observation and understanding. Udavartam, a patient with chronic constipation and Arsho-like presentation, all Pakwa Shegatavata, will lead to Gulma tomorrow, will lead to Hridroga tomorrow. At 35, if you have these symptoms, if we make them practice Anuvasana Vasti or Matra Vasti once a week or something, we can definitely prevent a Hridroga or a cardiac arrest at 45 or 55. There is no doubt about it. So this practice, it is not speaking about Ardhamatrika Vasti and all. We have to make this available to the common man in the best possible way. And many a times now, I make patients themselves, if they're quite, make them undergo Matravasti at home itself. Whenever I see this background of Udavarta and which can be related to Gulma, Hridroga, we all know now it is after Gulma only Hridroga has been told in our Shastra as a related thing. So this line of Apana, Samana, Vyana, then finally Udana and Prana is always there. And for all controlling this thing, Vasti is the best possible thing that we could advise. So I think towards the end, let the Niruhatva of Niruha continue. So the very word Acharya has mentioned, Niruha for Asthapanavasti, is why, because we ourselves are unable to understand the action that it can produce in the body. You cannot uha, you cannot guess, because it will produce n number of actions possibility according to the body's response to the shastra. I mean, body's response to the procedure, and what's intricate in the body we will be able to understand only once we do it and observe it. So let the niruha dazzle our mind and soul with more and more realizations and more questions. So thank you all. May the masters like Krishna Kumarji inspire us, bless us. Rather, I would say to experience Shastra, to understand Shastra, and finally practice Shastra. We can practice Shastra, I believe, only when we understand and experience Shastra. So let all of us understand and experience Shastra in the right and best possible way, so that we are able to practice Shastra in the best way. Okay, so I think with this conclude, I think I'm on time too. Okay, Dr. Sheetal.
Yes, ma'am. Yes, ma'am. In really beautiful session. Don't know what more to say. I was much more carried away, to be honest. Please don't take me wrong. Much more carried away and really had tears in my eyes. I don't know if people will believe me when you were talking in the initial phase about Sir. It's something that nobody can. I don't know how to express it. It's not replaceable and never can be understood its full way. Never can be expressed. So beautiful session, ma'am. Thank you so much. I've actually asked for some questions from our participants, and we have some questions coming in the chat box. Can we quickly
Yeah,
go
yeah,
through
sure.
questions, ma'am?
Then answer. Yeah.
Thank you so much. Ma'am, the first question is from Dr. Rishivandya. What is your criteria to assess Koshta before Vasti?
Yeah, that's a very practical and sensible question, Doctor. Four criteria we take it up actually. It is consistency, urgency, frequency. Okay, so the consistency of the motion that we pass, they pass. Okay, the frequency. So there is a score that we do it objectively. Okay, if the consistency is very loose, score 1. If it is very hard, thick pellet like, score 3. Okay, and in between, score 2. Urgency is like when they feel like the sensation of going to the toilet, are they able to hold it, or they just have to go it. So that urgency, if it is very less, it's very 1. And if it is there is no urgency at all, they can pass at their will, it is 3 again. Urgency, consistency, frequency. Okay, if it is 1 or 2 per day, it is again 1. Once in only 2 days, it is again 3. And the fourth one is the nature of bowel. When they have probably draksha juice, draksha swaras or little avipatti or milk, if their bowels get altered with all this virechi aushadas, again it is score 1, there is no effect, score 3. So the scores which are above 9 are considered as krura koshta. That means with hard consistency, difficulty to evacuate with less urgency, and the frequency is very less, along with there is no change in bowel. So if this is taken, we take it as into krura koshta, and below 6 if it is mrudu koshta, and somewhere between 5 to 9 it is madhyama koshta. So this is one criteria which we think.
Yeah, ma'am. Another question from Dr. Shivam. Uh, his question is a little bit different. He was thinking that mostly after operational procedures, mainly in GIT surgery, in allopathy, patient don't feel Shruta for the next some days. And over that, we give IV saline, NS, DNS, etc. So, do they play any role over Agni? Because they are the drava which may slow down the patient's Agni. Should we try need to think over that, or modification can work in such situations? Can we start with basic tea, biscuit, and bakery product?
Okay. So after any GI tract, will there be any kind of difference in Agni? And they will be given IV saline. Probably IV saline is given, saline, everything is basically rasam. I mean, clay, appadhatu, cledam. So there will be definitely hampering of Agni to an extent, which probably will be reducing the pool of ojas in the body, because there is no proper ahara rasa to rakta and all. That doesn't happen. So when that is basically, how is our mechanism? We have our Agni in the koshta. We have our ahara rasa. The Agni in the Koshta acts over the Ahara Rasa to make Ahara Rasa to Rakta and further thing. So there is some issues with the Koshtam during that particular surgery, and definitely the body's Agni, the body's the pool of health is under threat because this function it's not happening, and probably they have found out a different method, that is parenteral nutrition. So that when parental way of giving it, so that this ojas or the kleda, the same thing, ojas or kleda is maintained to an extent, because there will be definitely hampering of Agni. Instead of IV saline, should we go for this particular thing? If you could ask, should we try to think over that, or modification can work in that situation? There can be, because when is IV given? Only when there is difficult dehydration in the body. If there is no dehydration in the body, I don't think IV is needed. We can go to support Agni. Probably because of Agni is very lack, and because of some manipulation in the structure of Koshta itself, they are going for IV. So if the patient is having, if we could assess the patient and their Agni after the surgery is in such a way that it can imbibe or make it Ahara Rasa to Rasa, we can try these things. There is no doubt, and I don't think IV will be mandatory, but possibly because if it is this, that IV is given so that the OJS is maintained. So technology also supports the same principle, I believe.
Yeah, ma'am. Another question from Dr. Sri Lakshmi regarding multiple sclerosis case. Can you brief it a little more, and can that be cured through our treatment and management?
MS cases, there are many, things, but the MS cases do approach, especially as I told, I was dealing with a neuro OP at Ashtangam, so I do have such cases. So if it is in the initial stages and all, to an extent, complete exacerbation and remission exacerbation usually happens. So if optic neuritis comes initially and it's completely remission has happened, there are cases which don't recur after our treatment. How much the body is affecting after the first attack basically depends on the treatment. So there are some crippled cases immediately after the first attack and the further things wherein we could bring only little changes, and the already crippled cases wherein weakness have already set in because of this kind of sclerosis in the spine, sclerosis happening, multiple sclerosis happening in the brain matter or the spinal cord matter. If it we could actually arrest the progress. So this case, he was a young male who had this attack by 30 plus, when he was 30 plus, and gradually it was progressive, and he was on steroids, prednisolone almost for 3 to 5 years, but then the weakness was much higher, and it was much difficult for him to get up, and also the all proximal muscle, everything had gone basically. But with our medicines, with our Vasti treatment and all, we could actually support him. He was, his movement and the strength of the muscle was improved. Okay, so that was done. Quality to an extent we could improve, and whether we could retrieve or not, it depends upon the samprapti. But at all stages, definitely Ayurveda has got a very positive role to play. We can't say that this can be done or that according to samprapti. Usually it is my understanding, dhanyamla dhara, snigdha svedas like pirichil, erakili and all have got generally negative. It is kind of avarana. So Vasti and Ruksha Svedas have supported to a great extent in the response.
Yeah. Another question. As per Vagbhara, prior to Niruhavasti, Abhyanga and Svetana is to be done. So, is there any difference in effect in cases where it is administered before Niruha and where Abhyanga and Svetana is not administered before giving Niruhavasti?
All Niruhavasti must have Abhyanga and Svedana. There is no Swabhyakto. That is what it is told. So why Niruhavasti is done basically to evacuate things all over the body through the Pakwasya. It's not just Pakwasya. Swaviryavatno. The Dravya is acting through Virya. So Pradhana Karma can happen positively only when it is supported by Purva Karma. Purva Karma settles the body. So there are two practices generally we do. Local Abhyanga Ushma Sveda is given, Vasti, or whole body Abhyanga Ushma Sveda is given and Vasti is done. Okay. It is my observation that when we are doing whole body Abhyanga Ushma Sveda, the response of the Masti is much higher. Charaka says swabhyakto sveda. Okay, so snigdha spinna uttama. I mean, after even anuvasana vasti, abhyanga and svedana has to be done. So no niruha vasti has to be done before without abhyanga or svedana. And the best practice is you need not go for a 30 minutes or 40 minutes abhyanga. Just 10 to 15 minutes abhyanga, make the patient undergo a steam, and then make the patient go for vasti. But one thing you have to take care, if you are doing a whole body steaming, if the patient is not properly hydrated, after vasti, there are chances of blacking outs or loss of consciousness. So always, this response of the body or the response of the body is much higher. I mean, the volume or the sweating becomes much higher when we are making the patient undergo in a steam chamber. So we can go for as a nadi sweda in the lower abdomen area or in the back area, which will not be making so much of fluid loss from the body. Okay, but if the patient is quite balavan with properly hydrated, the best response happen when we are doing it in the steam chamber only. So that whole svedana is also relevant.
Yeah, ma'am. Another question from Dr. Leah. Can we give internal medications during Kalavasti, Yogavasti, and Karmavasti? Is it necessary to stop internal medicines?
Actually, no. Why are we giving? What is the intention of our internal medicines? Okay. So internal medicines can be given. One second. Okay. So what is the intention of ours giving internal medicines? Basically, it is to control, correct the samprapti alle. So when we are doing vasti, we are making some doshas come out of the body. Okay. The body is basically challenged to respond in a particular way. Okay. And once we are doing the procedure, the body needs a time to recover, recoup and all. So during the time of vasti, I don't feel it necessary to be given any internal medicines because it's not needed. Just imagine, why are we giving internal medicines? We are giving internal medicine so that again the medicines, it's Agni does the pachana to the medicines, and wherever there is dosha dosha samurchana, that is somewhere broken up with the internal medicines. Now to break that dosha dosha samurchana, we are going for vasti, and vasti is making some kind of change in the body in whatever way. Okay, so when that is happening, you need not coax the body too much with internal medicines. So usually we stop internal medicines during vasti, especially on the day of kashaya vasti. And if we are going for a niruha, taila vasti on the next day and all, some balya thing and all we used to give. Otherwise, generally internal medicines is not required as such. Hope I'm
Yeah.
clear.
Another question from Dr. Vidya Lakshmi. Ma'am, Vasti for Astikshaya. So, Kshira Grita combination with Tikta Rasa Dravya is told in Shastra. Any combination of such Dravya according to your experience?
Yeah, we do it with Panchatiktaka Kshiram. Okay, the Panchatiktaka Kshiram and Tiktaka Ghritam. Kshirad dau prasurdo madhu taila gridatrayaha khajena madido vastir vadagno balavarnakrat. The Kshira vasti. So madhu, taila and grita, three are there. Grita is Tiktaka Grita, taila madhyashthyadi Grita, and Kashaya we usually do it as Panchatiktaka Kashayam or Tiktaka Kashayam. Tiktaka Ghritas Kashaya Yogam is there, no? That is also taken as Kshira Kashayam and then done. There are n number of studies that has been done as this Panchatiktaka Kshira Kashayam and Madhu, Tailam Sahajaradi and Gridam Tiktaka Ghritam as Kalavasti and BMD, bone mineral density before and after was studied in osteoporosis cases, and there was significant increase in the bone mineral density of doing Shiravasti. So objectively also it has been proved, and we do practices according to the bala of the patient. Okay, if they have enough bala, we can go for almost Kalavasti like pattern. If they have enough time, at least Yogavasti we can do, and it has responded, especially in the knee issues, this varus deformity, people who are obese, difficult to walk and all. Once initial shodhan and all everything is over, Shiravasti definitely supports it.
Ma'am, another repeat question. Can you talk about the food administration before Vasti and its importance?
As I told you, na ati bubukshitaya, there are reference. So that means the patient should not feel too much of hunger. That, but little hunger has to be there. So that is the status of the Agni when we are going for medicines as Vasti. So usually what is there? There is no direct, what you call it as name. The Ahara should be Padahina for Anuvasana Vasti. Okay. Here, Laghu Ushna Ahara has to be given. That is the only thing. So we practically use it as paya we give usually, or any kind of stuffed thing like here idiyappam and all we give. No fermented material is given. It is given in such a way that little we give in such a way that if we are planning for Vasti at 9:30, we give a little food, I mean paya by 7:30 in a way that 9 or 9:30 the patient feels a little hunger. But it is very important that the patient does not feel too much of hunger, because if we do niruha vasti during the time of hunger, there are much more chances of going for complications. So it is, I usually, what happens, we post the the vasti at 9:30 because of some issues like some svedana or some other patient. If it get delayed by 10 or 10:30, I give the vasti. So before just giving the vasti, I ask the patient, okay, are you feeling any hunger? You are feeling any kind of this thing. So if the patient say, doctor, I am feeling too much of hunger and all, we used to give little bit of water or little bit of paya just before vasti. It's a protection. Okay. And once we give a little more, that may again lead to vomiting immediately after vasti. So that has to be balanced, but this appetite should not happen. So that you have to take care. If the young patient is very young with bala, all these things gets recovered. But when we are doing vasti to these kind of old people whose bala is generally low and all, these all things matter.
Yeah, ma'am. Another question from Dr. Shivam. Can you please put some focus on PCOS?
PCOS treatment, out of PCOD, it's like it's a big thing. Probably, I think you might have heard lot of things. That has to be corrected. In as far as Panchakarma is concerned, Snehanam Shodhanam Vasti is a great option. So usually, Snehapana we do it with Taila Snehapana, generally, and go for Virechana or Vamana according to the dosha dominance. And once that is done, Vasti definitely gets supported with how long where is the issue, like if how we have to assess the thing. If the patients, if it is exclusively amenorrhea for 3 or 4 months, once in a 4 months only bleeding is happening, there are different issues. No, females present, bleeding is normal, I mean menstruation is regular, but they are obese kind of things, and they have all other kind of hirsutism like presentation. If they may be having periods regular, but it will be scanty. So all these factors are taken into consideration, and we have to assess how much there is rasa dushti, rakta dushti, and how this thing. According to that, we have to plan the treatment. Okay. So if the patient is menstruating once in 45 days, if the patient is menstruating once in 60 days, just imagine what will happen. Rasad, Sthanyam or Striyam Raktam. So the patient who is menstruating once in 45 days, Rasa to Rakta, it's happening in that patient within 45 days. Somebody who is menstruating once in 60 days, Rasa to Rakta is happening within 60 days to an extent. So the Agni Dushti is different in both of them. So considering all these aspects, we need to decide the treatment plan. But definitely there is a role. There are conditions wherein lean PCOS comes, lot of stress in the background, and then only Shiro procedure like Tailadhara and some Nasya will support, makes the periods regular in those cases. So according to the understanding of the Samprapti, there will be definitely change. If there are practitioners whom I have heard without this Kriya Krama, if just in the initial stages, 6 to 9 months of internal medicines continuously, along with the diet modifications and lifestyle changes, definitely to an extent, people normally conceive, the issues come down.
Yeah, ma'am. I think taking the time into consideration, I'm forced to cut down here. We are already running over the higher time. So I think there are a couple of questions left out, but I'm really sorry for that. Really beautiful session, ma'am. So much of information for all of us to carry back, and a lot of, I should say, definitely the practical aspects. So I'm sure the participants are really, enjoyed the energetic sessions that came out from you. So it was really having you as a speaker, as the usual. Thank you so much for joining us and for giving such a wonderful lecture to all of us.
Okay,
Thank you.
okay.
Namaste.
Okay, thank you all. It was pleasure sharing with you what all little things I could know. Still remembering Krishna Kumar sir once again. Thank you all.